nowadays everybody tells, you get lot of scans of PCOS. Every patient, young girl coming with irregular periods are labeled as PCOS. Is actually the incidence of PCOS has gone up or not? Pratap sir?
Yeah, thank you very much for inviting me, Professor Aswath, for this chat show. Your question about incidence, I agree with you, the incidence has not really gone up that much, but sometimes it is overdiagnosed, especially for a young girl who's a little on the obese side, irregular cycle, and it is just branded as PCOS, but actually she's not. Because that's what I wanted to discuss with the postgraduates also, that though the Rotterdam criteria said irregular menstruation, evidence of hyperandrogenemia or and ultrasound finding, but 2 of the 3 should be there. But in an adolescent girl, all the 3 should be there. Only then you won't go wrong in incidence. In fact, the international guidelines have clearly said there is no need to do ultrasound in a young girl. Okay, you're going to otherwise overdiagnose and put the incidence very high. So the important message at this moment I would like to give is there is no need to do ultrasound to prove or disprove. For the first 8 years of menarche, there is no need of ultrasound because ultrasound sometimes overdiagnoses things. So we just go by the menstrual history.
Sir, the doubt is that when as you've taken about the ultrasound, see, they say that according to the new criteria, that is when the new Rotterdam was previously, now the PCOS guidelines have come in 2018. There are certain changes, they say. Is it correct that previously we used to take 10 to 12 follicles, now they say 20 follicles? Yes. What are the changes you expect actually?
Yeah.
Changes
number one is to emphasize again, ultrasound is not needed for adolescent girls.
Yes.
You remove that from the investigation. Just go by history. The international guidelines of PCOS 2018 have clearly said they're endorsing Rotterdam criteria and they're not against any of the criteria. They just want to emphasize the same thing. Go by the menstrual history. The only change is strict menstrual history, less than 21. So the first 1 year, every girl has irregular cycle. So it's not a botheration. Beyond 1 year, anytime less than 21 days and more than 35 days itself is anovulation. So anybody having more than 3 months is for sure anovulation. Hence all these faster cycle, longer cycle, they are all suspicious of PCOS. So the strong history is menstrual history. More than 3 months is for sure. Anything even later, early is also considered. That's the change. They've emphasized on that. And the other emphasis is that, there is hyperandrogenism diagnosed only by clinical examination, by looking at all the parts of the body, and Ferryman-Galway scoring is the criteria now.
So the Ferryman-Galway scoring.
Ferryman-Galway scoring, we were taking it as 8 before score, but now even 4 to 6 is considered as diagnostic of PCOS. So I think all of you should, the people are attending today, they should read Ferryman-Galway score.
And that is about 9 sites have been done, and 9 sites like from the upper lip, lower lip, chest, arms, lower arm, back, and buttocks, and all.
Correct. So, all areas.
All areas. Also, also the criteria includes acne as well as alopecia. Also, sir, they say that acne, comedone acne, and alopecia. They use some criteria called Ludwig score or Ludwig score.
Ludwig scoring is there, but international guidelines have set both the scoring, but the Ferryman-Galway scoring doesn't have all that from acne and all that. But acne is a part and parcel of hyperandrogenism. So the role of evaluating by history and examination is the most important in diagnosis. The rest of it goes secondary.